Assalamu alaikum respected doctors. Welcome to my YouTube channel MBBS and BDS lectures. Today is the fourth video of repeat revision course of Complete Denture prosthodontics. In this video we will discuss about impression trays. Now in this chapter we will discuss about impression tray, parts of impression tray, and types of impression trays, and construction of special trays. Now first we start from impression tray. What is impression tray? Now it is a device used to carry, confine and control the impression material from patient mouth while making an impression. During impression making, the tray facilitates insertion and removal of impression material from the patient mouth. Impression tray is a device used to carry, confine and control the impression material, and it helps in insertion of impression material into the patient mouth and removal of impression material from the patient mouth. Now come to the parts of impression tray. Now impression tray consists of two main parts. Number one is body and number two is handle. This is the parts of impression tray. Number one is body, number two is handle. Now then body again have two parts. One is floor, which is flat, and next is flange, which is elevated part, and next is the handle, which is L shape. Now first is the body, and body it consists of number one floor, number two flanges. Second is the handle. Handle is an extension from the union of floor and labial flange in the middle region, midline. Handle is originate from midline of the tray, where floor and labial flange are from the meeting point of floor and flange. Now it is L in shape. It is L in shape. It will not. Why it is L in shape? So that it will not interfere with the lip during impression procedure. Now there are upper tray to make impression of maxillary arch and lower tray to make impression of mandibular arch. Because we already discussed about anatomical landmark which are different in mandible and maxilla, therefore tray are also different for maxillary and mandibular arch. The difference between them is that the upper tray, that is a palatal portion, upper tray have palatal portion but lower tray have not palatal portion. The additional part in the mandibular tray is the lingual flanges, which are come in the lingual space, between tongue and teeth. Now the difference between that is the upper tray, this is a palatal portion we called vault, and in the lower tray there is a lingual flanges. Now come to the upper and lower tray. This is actually upper tray which have palatal part, and this is a lingual tray this is a lingual tray which have lingual flanges. Now come to the after parts of tray. Now come to the types of trays. There are two main types of trays. Number one is the stock trays, and second is the special tray or individual tray. Now stock trays are come in metal, plastic, and stock tray is not for a specialized patient. We can use a stock tray in any patient, and stock tray are come in different size, in three sizes like small, medium and large. When in the start of impression making, we first check tray and patient arch, either small trays fitting or medium or large. Any tray which is fit in the arch, we will select that tray. It may be small, medium or large. Now, this is stock tray. Next is a special tray or individual tray. Why it is called individual tray? Because this tray is only para that patient. This is special for that patient. They are known as special tray or individual tray, are also known as custom tray. Now, types of tray, there are two main types. Number one is stock tray. What is stock tray? They are used for primary impression making. We use for primary impression making. Next is the special tray or individual tray. These are used for final impression procedure for specific patient. Now come to the detail of stock tray. Now, stock tray serve to carry the impression material to the mouth and support it in the correct position while it is hardening. This type of tray can be used for several patients and used for making primary impression, which is the first impression, primary impression. They are made up of different materials such as aluminum, stainless steel, tin, brass or plastic in variety of shape, size were made to fit different mouths. They are made of different material like aluminum, stainless steel. This is the stainless steel. And also we can make from plastic. Now come to the next is the this is the plastic. In diagram A, this is the plastic tray, stock tray. Now come to the types of stock trays. Now, stock tray, we divide stock tray into two categories. Number one is stock tray for dentulous patient, which have some teeth but some teeth are missing. And next is the stock tray for edentulous patient, which have edentulous is that patient which have no teeth in the mouth. All teeth are missing. Now, how we differentiate between edentulous patient stock tray and dentulous patient? We can distinguish between them by stock tray from dentulous patient, means stock tray for dentulous patient, which have in this patient some teeth are missing, have long flanges, wide and flat floor, while other for edentulous patient have short flanges, oval and narrow floor. Now look at this. We can distinguish between them. Number one is stock tray for edentulous, which have no teeth in figure A. Next is the stock tray for dentulous patient, which have teeth. Some teeth are missing. Now, first, in stock tray for edentulous, the flanges are short, but stock tray for dentulous, flanges are long. Second is the stock tray for edentulous have oval and narrow floor, and stock tray for dentulous have flat and wide floor. Tray with combination flat and oval floor is suitable for partial denture work. For partial denture work, we use tray with combination of flat and oval floor. Now come to the stock tray can be. First we divide the stock tray on the basis of patient mouth condition like dentulous or edentulous. Second, stock tray can be classified according to impression material into two types. Number one is perforated stock tray, which have pore, and next is a non-perforated stock tray. Now look at this diagram. The first is the non-perforated stock tray. Second is the perforated stock tray. Now come to the first perforated stock tray. Then again perforated stock tray we divide into two, A and B. Then again non-perforated stock tray, again we divide into A and B. First is the perforated stock tray. We divide into perforated stock tray without rim lock. Second is the perforated stock tray with rim lock. Now, these types, perforated stock tray without rim lock or perforated stock tray with rim lock, these types use with alginate impression material. Now, what is rim lock? Look at this diagram. There is a rim lock which are shown in red color. A rim lock is for locking the impression material. These are the locks in impression tray for locking the impression material. Next is the perforation. What is the purpose of perforation? For better retention of the impression material, because it gives retention to the impression material. Next is the non-perforated stock tray. The non-perforated stock tray, again we divide into non-perforated stock tray without rim lock, used with impression compound, and which is mainly used for complete denture primary impression. Second is the non-perforated stock tray with rim lock, used with alternate impression material. Next, these are the types of stock tray on two bases. Number one, on the basis of patient teeth condition, mean dentulous and dentulous. Next, on the basis of impression material, mean into perforated and non-perforated. Perforated mainly we use for alternate, and non-perforated we use mainly for impression compound, because impression compound are locked in that perforation. Now come to the factor affecting in selection of stock tray. When we select stock tray per patient, which factor affects the selection of stock tray? Now, there are 5 factors. Number 1 is the type of impression material used in the primary impression procedure. Example, with impression compound, we use non-perforated tray because it will be stick on the tray. And if we use alternate impression material, we should use perforated stock tray for better retention. Mean perforated stock tray is used for better retention of alginate, and when we use impression compound, we will not use perforated tray. Second is the size of the arch. According to the size of the arch, there are 3 sizes of the impression tray: small, medium, and large. And at the handle region, in small have S, and in handle there will be if on handle there is a in written form there is a S mean small, M mean medium, L mean large. Mean on the size of the arch. For small arch size we use small, for medium we use medium, and for large we use large. Third is the form of the arch. What will be the form of the arch? Form are come in 3 types. Number 1 is round, second is square, third is taper. And that basis we will select the impression tray. Fourth is the stock tray must cover all the anatomical landmark needed in the complete denture. And this is the most important point. Mean stock tray may not be underextended or overextended. It must cover all anatomical landmark, like limiting structure, supporting areas, relief areas. Fifth point is the stock tray should give us sufficient space to impression material in all direction. The stock tray should leave sufficient space, room or space for impression material. How much space? 4 to 5 mm. These are the 5 factors which affect the selection of stock tray. Now come to the second types of tray: special tray or individual tray or custom tray. What is special tray? An individualized impression tray made from a cast. How we make special tray? First we take impression by impression compo. This is primary impression by stock tray. Then we pour this stock tray. We will get a cast. This is known as primary cast. Then on primary cast, we will apply separating media, and when we applied base plate wax, and on that we will mix self-cure acrylic resin, and we make a tray on that primary cast. This is known as the special tray or individualized tray or custom tray. Now, what is special tray? An individualized impression tray made from a cast recovered from primary impression, mean primary cast. It is used in making a final impression, because we always take primary impression from a stock tray, and we take final impression or secondary impression from special tray or individual tray or custom tray. Special tray is constructed on primary cast. As edentulous ridge show variation of shape and size, some have plated ridges and other have bulky ridges. For this reason, stock tray can fit the ridges only in arbitrary manner, so special tray is constructed. Why will construct special tray? Because due to edentulous ridge variation in size and shape, like some have flat ridges and some have bulky ridges, and therefore we should make a separate tray for that patient, either it has bulky ridges or flat ridges. Now this is the look at in white there is a primary cast, and above primary cast we have a special tray which we made from self-cure acrylic resin. Now come to the advantages of special trays. There are 6 advantages. Number 1, economy in impression material. Use less impression material required in special tray. In special tray, there will be less material required. Second is the more accurate impression because it is specialized for that patient. Third is the special tray provide even thickness of impression material. Mean every area there will be same thickness. This minimizes tissue displacement and dimensional changes of impression material and produce impression with a correct extension. Fourth is that the work with special tray is easier and quicker than modifying stock tray. We can modify stock tray, but the work with special tray is easier and quicker than modified stock tray to provide accurate impression. The fifth advantage is special tray is more accurately adapted to the oral vestibule. This helps in better retention of denture because it is specialized for that patient. 6. Special tray is less bulky than stock tray, which is more comfortable for patient. Because mostly we use a stock tray which is made up of stainless steel, and that is metal which is bulky, but special tray we make from self-cure acrylic resin. When we trim the tray, it will be very light in weight. Next, compare the material used for construction of special tray. From which material we can construct special tray? There are 5 types of material. The special tray can be constructed by use of different materials. This is depend on the type or technique of impression taking. It can be constructed from number 1, cold cure acrylic resin or self-cure acrylic resin or autopolymerizing resin. More commonly, mostly in our dental lab, we make special tray from cold cure or self-cure acrylic resin. This is the self-cure acrylic resin which is red in color. Second, visible light cure acrylic resin, mean from visible light, same red in color, like this. Third is the shellic base plate. This is again self-cure. This is a shellic base plate which are white in color. Next is the impression compound. Sometime we make from impression compound which are also red in color. Next is the heat cure acrylic resin. Rarely, mean more commonly from self-cure acrylic resin, then sometime from impression compound, and very rarely from heat cure acrylic resin. These in first diagram this is per maxillary arch, in second there is per mandibular arch. Now come to the types of special tray. We have 2 types of special tray. Number 1 is the spaced special tray. Spaced special tray, then spaced special tray with or without stopper. Second is a close fitted special tray. Now, what is spaced special tray? In spaced special tray on primary cast, first we apply separating media which is cold mold seal or Vaseline. Then we applied base plate wax. Then above base plate wax we applied self-cure acrylic resin. When self-cure acrylic resin set, we remove the tray with base plate from impression from primary cast, and then we remove the base plate wax from the impression. When we sit the special tray on the cast, there will be a space between tray and cast because we first this space is covered by base plate wax. When we remove the base plate wax, there will be space. And sometime in canine and first molar region, we leave some amount of base plate wax, which is known as stopper, which stop the tray in that area. Now, the types of special tray, we have two types of special tray: space special tray and closed fitted special tray. Then in space, with or without stopper. First, look at this. In diagram A, there is a special tray. There is a space between primary cast and tray. In second, also there is a space tray, but in first there is a with stopper. Look at the stopper between tray and cast. In diagram B, there is a no stopper, without stopper. There is no stopper. Now, this is the types of space special tray. Look at the closed special tray. There is a no space between tray and primary cast. Yellow is the primary cast and red is the tray. There is a no space. This is a closed fit special tray. Now come to the technique or method for construction of special tray. What are the technique or methods for construction of special tray? There are two methods. Number one is the finger adapted duff method. Third is the sprinkle on acrylic method. But sprinkle or acrylic method are rarely used. We mainly use finger adapted duff method. Now, come to the first finger adapted duff method. It is very easy. First, we take primary impression by stock tray. Then we make a primary cast. Then on primary cast, first we apply separating media. And on separating, above the separating media may be Vaseline, maybe cold morphine. And above that, we will apply base plate wax in space special tray, not in close fitting. And in stopper, in canine and first premolar area, we leave some base plate wax, which is known as stopper. This is simple technique. Now, finger adapted duff method. In special tray with stopper, we should have 4 stopper, 2 in anterior area, canine area, and 2 at posterior area. This is the for lower arch without stopper, and for upper arch with stopper. Look at this. Now, in special tray with stopper, we should have 4 stopper, 2 at anterior area, canine area, and 2 at posterior area, first premolar area. In both sides, a base plate wax sheet 1 mm in thickness is adapted on the cast after heating the wax, and a window open on the wax sheet in area of stopper by removing the wax to make the stopper, and then put a uniform layer of self-cure acrylic resin upon it. When we remove the wax, there is a space with a 4 stopper which will stop the special tray in the mouth of the patient and stop the pressure on the material during the making the impression. While for space on without stopper, a base plate wax 1 mm thickness is adapted on the cast. After heating the wax, then put the acrylic resin on it. When the wax is removed, there is a space without stopper. Look at this. Now, in closed fit special tray, we use only separating medium on steady cast, on primary cast, and a self-cure acrylic resin tray material is mixed and uniformly adapted over the cast so that the tray will be above 2 to 3 mm in thickness. Acrylic resin handle is attached in the interior region of the tray to facilitate removal of the final impression. This is handle with special tray per upper arch, and this is per lower arch. Now come to the criteria for special tray construction. Mean how we create special tray. For special tray construction, there is a criteria which have 6 points. Number 1, the impression tray must not impinge upon movable structure. This should not impinge upon movable structure of the oral tissue. Second is the border must be underextended 2 mm. 2 mm the border will be underextended. Look at the tray. There is a on the lower surface of the tray in flange area there is a 2 mm short, because at that area we will be do mortar molding. We apply the sticky wax. We will apply the green wax on that area for border molding. I mean, we applied green stick wax bar border molding. Third, the posterior limit of the impression tray should be slightly overextended to ensure inclusion of the posterior detail for development of the post-dame area in upper tray. I mean, in upper tray, we should extend posteriorly slightly overextended in order to record the post-dame area. Fourth point, the tray should be rigid and of sufficient thickness that it will not fracture during its use. The fifth point is the tray must have a handle for manipulation and the handle must not interfere with the functional movement of the oral structure. Sixth is the tray must be smooth on its exposed surface and should have no sharp edges which would injure the patient. Now, this is all about the fourth chapter of Rapid Revision Course of Complete Denture prosthodontics, which is impression tray. Now, today our chapter is complete. If you find this video helpful, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.